Our presenter today is Catherine Campbell. Dr. Campbell's research examines the values and motivations and decisions in making food systems. Her primary focus is human motivation and behavior as it relates to farmer adoption of new technologies and practices. She works with food systems, public health, food securities, and health outcomes. So that's really her driver for these food systems is overall improved general health. And the ultimate goal of her research is to understand policies and systems so we can leverage those for accessible, sustainable, and resilient food systems from the producer to the consumer. And we're very proud that Catherine serves on a USDA National Committee for Urban Agriculture. She and her fellow committee members report directly to the Secretary of Agriculture in Washington. So, Catherine, with that said, we are so happy that you're here. And I'm going to go ahead and stop sharing. And so you can share. Welcome to the Master Gardener webinar. And we have about 275 people on today to watch your presentation. So please get started whenever it's convenient for you. And thank you so
Right.
much for being here.
Thank you so much. Can you hear me okay?
Yes, I can. You could speak a little bit louder.
All right. I will speak louder. Well, thank you all for having me. Thank you, Wendy, for that great introduction. My name is Catherine Campbell, and I'm an assistant professor and extension specialist at the Department of Family, Youth, and Community Sciences in UF IFAS. Can you advance the slide? So this session, bear with me. We're going to get to the part where gardening is salient, but we're going to take a little detour through some issues related to food access and food security. Then I'm going to talk with you a little bit about community food environments, and I'm going to introduce you to the concept of the 5 A's. And then we're going to talk about how gardens can support food access and address some of the issues that I'm going to lead off with. Next slide, please. All right, so to begin, food security is defined by the USDA as when households have enough resources to have access to adequate food for an active, healthy life. So a household is considered food secure when all members at all times have access to enough food, access to food that is safe and nutritionally adequate, and they have the ability to acquire those foods in socially acceptable ways. Next slide. So one thing that's important to note is that food insecurity is not hunger. So food insecurity is a household level economic and social condition where people have limited or uncertain access to adequate food, whereas hunger is an individual level physiological condition that could be a result of having food insecurity. Next slide. So part of why it's important to think about households that have low food security, you can see on the chart here, households that have low food security have issues of worrying about running out of food, buying food and it running out, skipping meals. In some cases, parents skip meals so that their children are able to eat food, not eating for whole days. And so it is a very serious problem. Next slide. And, it's a very serious problem, and it's one that has a high prevalence. So almost 13% of households in the US are food insecure, but here in Florida, our rates are higher than they are at a national level. So that's 14%, and almost 1 in 5 children live in a house that's food insecure. Okay, so I want you all to find out what the prevalence of food insecurity is in your county. So we're going to share a link with you, and I would like you to go to that link and find your food insecurity rate for your county. You can just select your county name at the top, and I'd like you to type in your food insecurity rate in your county and put it in the chat so we can kind of see what the differences are around the state. Is it not clickable in the chat there?
Let me try and see what's going. The page isn't loading, so let me try
Um,
see if we can find another page. So I'll try this. Everybody be patient with us. The gremlins are active today.
Extremely active. It may be that you all trying to click on it at the same time.
I
There we go.
okay. Lucy got it to load. Okay.
All right. Well, so that's great. And part of why I wanted you to do this, and thank you for bearing with us, is that it's important to understand how these kinds of metrics that often get reported at the state level, there's a lot of variation across counties. And as we move forward, I'm going to be talking a little bit about how some of these kinds of metrics that we talk about differ even within counties. Okay, so thank you all for doing that. If you are able to click that link and pull that up, even if I've moved on in the presentation, please do that. And so you can think a little bit about how your county's food insecurity compares to some of the other counties as well as the statewide average. Okay. Some of these numbers are really, really notable. Okay. Um, so why do we care about food insecurity? Part of it is that there are issues of diet-related health issues when people are food insecure. So even not taking into account food insecurity, 85% of Florida residents don't eat the recommended servings of fruits and vegetables. 67% of Florida residents are overweight or obese, and 11% of Florida residents have been diagnosed with diabetes. Next slide, please. So there's a strong link between food insecurity and poor nutrition. Limited access to healthy food among food insecure households leads to the negative health and outcomes I was talking about. So obesity is a growing problem, and there's an inverse relationship across the United States with income and body mass index, where homes with lower incomes have higher body mass index. And then finally, individuals with highest food insecurity are at higher risk of a variety of diet-related diseases, such as uh, obesity, diabetes, and hypertension. Uh, Next slide, please. So we've been talking about food insecurity, which is just access by all people at all times to have enough food to live an active, healthy life. But over time, people have come to realize that the concept of food insecurity is a little limited in that it's really just focused on number of calories. And so they've started to change to focus a little bit more on what is considered nutrition security, which is having access to food that supports overall health. And so it builds on food security, but then also looks at the link between food insecurity and diet related diseases. And it builds in the 5A's framework that I'm going to talk about shortly. Okay. So next slide, please. So community food environments, it's a fancy term that just means the places where in our communities, the built environment where people shop for and consume food. And so there are a lot of ways of describing this, which have to do with, the kinds of stores that are available, the number, density, or ratio of places to obtain food, locations and hours, the cost and quality of available foods. Next slide. So I see Trudy mentioned in the chat that she did a community needs assessment in Hillsborough County. So that's great, Trudy. Those are the kinds of things that people like me really want community members to do to be aware of their community food environment. So I'm gonna start explaining these 5 A's to you that I keep talking about. So the first A is one that people are very familiar with, and that's the A of access and food access. And so there was a lot of talk and interest in what were used to be called food deserts about 10 years ago. There was an increasing awareness of there is this overlap of food insecurity and lack of access to healthy food. So USDA defines food deserts and a lack of access to healthy food by sort of the time it takes to travel to shop for healthy food and the availability of healthy food in communities. And so the original concept really just focused on lack of grocery stores. So food deserts were places where there are a large proportion of residents with low income, and there's a limited access to healthy food by which they really just focused on grocery stores. And so over time, we've sort of changed the terminology. So some people still use the term food deserts, but now the more preferred term is LILA areas or low income, low access areas. Next slide. So we were talking about food deserts where there's limited access to healthy food. Another concept is food swamps. So those are low income, low access areas that have an abundance of unhealthy or inexpensive food options. So these are areas where there are a lot of fast food restaurants, liquor stores, convenience stores, and these kinds of places, they are access to food, but it's not healthy food. So it's calorically dense foods. They typically will stock foods that have a longer shelf life because they're affordable and convenient. They'll have fast food restaurants, which are more prevalent in these low income, low access areas. And so, people who live in food swamps are more likely to have higher rates of obesity, particularly in areas where residents don't have access to drive cars. So they are reliant on these kinds of unhealthy food options in their environment. And they have higher hospitalization rates of people with diabetes in these food swamp areas. Next slide, please. So we had food deserts, we had food swamps, and now we're going to talk a little bit about food mirages. And so these are areas where there may be healthy food available in the community. So there may be grocery stores, but the high prices of those food options make it so that the food is inaccessible to residents. And so there may be healthy food establishments, but they're unaffordable for residents in those communities. Next slide, please. Okay, so we're gonna try to do a link again. It may or may not work. So I would like you, if you can, we'll drop a link in the chat that you can go to find the areas in your county that are low income and low access. And so you can also, in this case, just Google food desert locator. And you want to go to the USDA Food Access Research Atlas, which typically would be the top thing when you search. And in the top left, you can put in your county and pull up your food desert map. Next slide, please. That's great. Yep, next slide. Here's a map of Alachua County, just as a for example. So when you go to the map, you'll have it such that only the green areas will appear. And so those are areas that are both low income and low access. And those are areas that were formerly referred to as food deserts. And so what I'm showing on my map are the differences between areas that are low access and then areas that are low income, and then areas that are both low income and low access. And so the areas that have both of those are the sort of priority areas for doing kind of food systems interventions to address these issues in the community food system. All right, next slide. Okay, so we're continuing on with the A's. So the food access was the first one we talked about, and that is represented in your food desert map that hopefully you've been able to pull one up for your county. Um, and so over time, we've come to realize that the relationship between food access and people actually getting the food that they need is a little more nuanced than just are there grocery stores present. So the next A is food availability. And so this has to do not just with whether the stores whether there are stores, but are they available for people to access them? So things like are the stores open hours that people want to be able to access the food? And we measure that at the community level. Next slide. The third A is a very important A, which is affordability. So you recall the food mirages I mentioned before. So these may be cases where their food is accessible and available, but it's not affordable, right? And so we need all of these different A's to actually address people's needs and ability to eat healthy food. So food of affordability is the price, whether people think the price aligns with the value, and whether they have their financial resources to be able to purchase it. Next slide, please. All right, fourth A, food acceptability. So this gets to the sort of individual subjective perspective on whether the food meets their needs. Is it appropriate? Is it convenient? Is the quality and variety really what people are looking for? Is it culturally and socially appropriate? And so these are all important factors to think about of whether the food in someone's community is actually going to meet their needs. Next slide, please. And then the last A is food adequacy. And so that refers to the nutritional quality of the food that's available. So basically, can people eat healthy dietary patterns? Are they able to get those 5 servings of fruits and vegetables versus having access to, those foods that are maybe low nutritional quality that are available at fast food restaurants or convenience stores? Okay, next slide. All right, so now I told you we would get there. So we're turning now to the role of gardens in improving community food environments. So just to recap, we started with food insecurity and the potential nutrition related negative outcomes that come from being food insecure or not having access to healthy food. We talked a little bit about community environments, community food environments, the various dimensions of thinking about accessibility of food. And now we're turning to the role that gardens can play in addressing the 2 issues that I was just talking about. And so you all know a lot of this, but it's worth highlighting in the spirit of thinking about how gardens fit into the larger picture that I've been talking about. So first, gardens play an important role in communities in developing social capital and community cohesion. So they create opportunities for community development, improving social connections, strengthening intergenerational relationships and residents' pride of place, and providing a third place for community members' social interaction. And so in thinking about the A's that I was talking about, these can have an important role in making the food acceptable to community members because they have this role in being a member of a community garden or working with other people around them. Next slide, please. Another important benefit, of gardens is cultural integration and preservation. So it creates opportunities for intercultural interaction, can help immigrants or people that are new to the area gain a sense of belonging. And it can allow cultural expression or maintenance of cultural heritage. So in these cases, where people may have certain kinds of foods that are common to their cultural heritage. They're not available for them to buy. One of our A's, they're not available to buy in local stores. They're able to actually grow them so that they can cook the food that is culturally relevant to them. Next slide. Another important benefit of gardens is the opportunities for employment and youth development. So gardens create opportunities for people to develop new skills, to learn about agriculture, nutrition, sustainability. It's an activity that can promote youth development, including job training, and it can also provide employment opportunities, workforce training opportunities, particularly for low income and socially excluded populations. And so, this is important in thinking about, the broad picture that we're talking about here with community food systems, right? So these areas that are low income and low access and households that are food insecure, as I mentioned before, that is a household's economic condition, right? And so gardens do play a role in making food available, but they also can play a role on the economic and job development side of helping people develop skills or do some entrepreneurial activities that can help them earn more income that can benefit those communities. Next slide. Another important role of gardens is community redevelopment. As I was just talking about, entrepreneurial urban agricultural activities, they can benefit the community members directly, but they can also attract capital and create new business opportunities, particularly in distressed areas. And they can have a benefit of increasing property values surrounding community gardens, particularly in economically disadvantaged neighborhoods. Next slide, please. So now we're getting to one of the outcomes that people most commonly associate with gardens when they're thinking about food access and food security, which is that if people are gardening in communities, you are directly increasing access to fresh, organic, and culturally appropriate produce. That's both for the gardeners themselves and their families, as well as the community members at large. It can produce cost savings on groceries or access to otherwise unaffordable foods. It can help meet a proportion of community fresh produce needs. And so this is particularly important as we've been talking about, the map and the areas where people have both low income and limited access to healthy food. If people are growing produce in their community, it can help meet their community fresh produce needs. And it also can provide an opportunity for cities to produce food in times of crisis. I think many of us remember the important role that gardens played in the COVID-19 initial lockdown period, where it gave people the ability to access food when grocery store shelves were empty. Next slide, please. And so in addition to the food just being available, it also, having gardens increases people's fresh fruit and vegetable consumption. There's a lot of research that shows that households with gardeners in them eat more fresh fruits and vegetables. And that's true not only of the individual who does the gardening, but also other family members. And there's also been research where youths who participate in gardening programs are more likely to try fruits and vegetables that they've grown, as well as other fruits and vegetables. It makes them a little more willing to try new and different fresh fruits and vegetables. Next slide. Another important benefit, as we've been talking about, I started at the beginning with a variety of health disparities that are related to food insecurity and community food environments with low access to healthy food. Obesity is another one of the negative health outcomes, which is affected not only by the food that you're eating, but also having physical activity. And gardens play an important role in supporting physical activity. Some research has shown that um, for people who are seniors, they can meet all of their physical activity needs just by gardening. It also has important mental health and therapeutic benefits, stress reduction, cognitive stimulation, connection to nature. And then gardens also play an important role in supporting ecosystem services. So they provide air filtration, temperature moderation, and these can benefit the health of urban residents that may have, an urban heat island effect because they're surrounded by so much pavement. Next slide, please. There are also a variety of environmental benefits to community gardens. So, if we're growing food within cities, we're reducing greenhouse gas emissions from food transportation, particularly for air freighted produce. So, if your berries are flying from South America, that's producing a lot of greenhouse gas emissions. You can have carbon sequestration by vegetation and crops. It can reduce energy and resource inputs in the food production. It increases biodiversity and pollinator habitat, which I'm sure you all are very expert at. It can reduce air pollution and help with temperature regulation in urban areas. Next slide, please. So some final thoughts. Food insecurity and lack of access to healthy food has substantial negative health impacts. And we've got extensive data, which I was sharing with you on the social and community benefits of gardens. And it's important to remember the 5 A's. So as you walk away from this presentation today and think about potentially what your role can be in helping your community with gardens, think about those 5 A's and, working with community members to implement programs that will be, acceptable and available and accessible to them in ways that can really help them address their community issues. And I was hoping we could see maybe who had the highest and the lowest food insecurity rate in the chat. Does anybody feel like maybe they had the highest rate?
We had Leon County with up to 16.6. Hernando 14.8. Pinellas they gave a child statistic for children, 25%, which I was quite surprised at. Hillsborough up to 17%. 17% of children in Lee County. So, that 25 in Pinellas children seem to be the highest.
Yeah.
And then that Leon County, at that 16% was pretty high, sounded high. Most people, Seminole coming in at 21.3.
Wow.
I'm surprised. Wow.
Well, thank you all for that. I think it is important to kind of understand these differences across counties and the difference in needs. And I hope was anyone able to get their food desert map?
I did the same one for Gainesville because you and I live in Gainesville. But okay, Seminole was 12.3, not 21.
Okay.
But just for fun, I put in Taylor County, and it seemed like the whole county was a desert.
Was a food desert?
Mm-hmm.
Yeah. And so I think, those kinds of things when we're thinking about, if we're interested in establishing garden programs to help our community members, having targeting those areas as places that could potentially use some increased access to healthy food.
Yeah, and I think
Um,
coming in with the statistics like that, with these resources that you shared, really helps to put the science behind it. You know, oh, a community garden is a good idea, or a vegetable gardening class is a great idea. It is, and this is why I think would go on a little bit further. And then some people asked some really cool questions, Catherine. Someone suggested that another A could be academics, the knowledge of knowing how to prepare food. So we have time.
yeah.
So if you'd like to unpack this, and then another A suggestion was agency, which is, and so if you'd like to discuss both of those, I'd like love to hear it.
Yeah, yeah. So I love food academics. There we could um there are some other A's. So academics is a great one. I think, these programs that can not only help people learn how to grow food, but also be educated and, understanding food that grows well here that maybe people aren't as familiar with. They maybe don't know what certain kinds of crops that grow well in Florida are, and helping to bridge that gap a little bit. That's really important. And whoever said agency, like gold star, that actually is another. So in some of the frameworks, there are 7 A's, and agency is one of them. And it is that ability to, access food yourself and feel like you have that agency or autonomy. I see Trudy mentioned in the chat. Like those are great. And I like to introduce the A's since, like, thank you for bearing with me on that. But it's one of these things that, as I mentioned, 10 or 15 years ago, people started um, thinking a little bit more about what is happening in communities that were then referred to as food deserts. And they were really just focused on the basic access piece. And as time has gone on, we realize that it's a little more nuanced, it's a little more complex than just, is there food there? And so thinking about, availability, affordability, its acceptability, do you have agency? All of those things are so important, not just in the food being available, but are people actually able to eat it? Is it meeting their needs in, socially acceptable ways?
Yeah.
Yes, yes,
Um,
exactly. Social determinants of health. Trudy and I are like, she could be giving this presentation, I think.
well, know that she's
um,
a resource for you in Pinellas County. So remember that.
yeah, okay.
She's a RD. So there you go.
Oh,
Um,
great. I was going to answer Diane's question.
oh, please do.
Yeah, so Diane asked in the chat where I mentioned the 85% of residents that don't get their 5 servings a day. So that data comes from the Behavioral Risk Factor Surveillance Survey. And so that is a population level survey that those data are collected uniformly across the United States and have been for decades. And so those data I pulled off the Florida Department of Health's website, and it pulls the data um, from the federal government. But so those are sort of key indicators that are collected at population level around the United States. I almost asked you all to pull those data for your. I'm glad I didn't, given the trouble we had with the food insecurity. But you can look at those statistics. Basically, anything about servings of fresh fruits and vegetables, like 3 servings, 5 servings, obesity, diabetes, all of those data are available at the individual county level. They don't collect them at the county level every year, but it's like every other year, and they have state level data from every year. But those are all accessible to you, and I think it can tell a really powerful story about the health of our community.
Yeah. Good. Over in the question answer box, Mary Jo asked, What percentage of people know what is good or not good to eat? Many people I've met in my life don't want to eat foods that are good for them. And I mean, most people I would never ask this question to, Catherine, but I feel like you might have a grasp on, what is the food, the nutritional literacy of Americans?
I think, I mean, so I must have the disclaimer of I'm not a dietitian, so it's important to say that. But I think, literacy is pretty low overall. I think, we all have a lot going on in our lives, and the food that is most available to us and advertised to us is not necessarily the healthiest food. And so I think um, it can be a challenge to know what's healthy and have the time and resources to get the food that's healthy and actually know how to cook it and prepare it. I did see somebody posted in the chat, which is something that I've read as well, is that the United States does not grow enough fresh produce for everyone to get 5 servings per day. And so this is another one of these cases of like more gardens, more home food production, more community food production to actually have the amount of food that we need to actually feed everybody the dietary guidelines of America. And it's important to think about, not just the behavior side, but is that food even available for people to consume?
And this is what someone brought up the new food pyramid. Would that play that come into play as well for that?
I I do not know all the details of the new food pyramid. Again, not an RD. But I think, there is an increasing focus in focusing on whole, real foods. And that is one of the things with the new food pyramid. It's focusing on real whole foods, and increasing fruits and vegetable consumption is a key part of that.
Yeah. Meryl O'Rourke was talking about that she works with a community garden at Goodwill Day program, and they raise their cooking and they're sharing, and this is how master gardeners can be part of the solution, or at least contributing to the betterment of food insecurity in our community. So Meryl, hats off to you for doing such a great job there. And then remember that when you are working in those community gardens and teaching people about edible landscaping or edible gardening, that don't forget that you have that FCS agent in the office, and they can partner with you about recipes or cooking or preservation or just all of that and the food safety. So, we get in kind of our little horticulture silo, but remember, we do have the resources to help people to get that garden that to get that food from the garden to the plate and into their bodies for nutrition.
Yeah,
Catherine, you want to
and
add on that?
I did want to mention, that we have, Wendy, you and I worked on all of those beautiful fact sheets that are soon to be available on the EDIS website. They're single one-page fact sheets of crops that grow well in Florida. And they have a little bit of information about gardening, but also information about the cultural heritage of the crop, how to store it, how to prepare it, how to reduce food waste. And so there are going to be 53 of those. And they're designed to be used by folks like Master Gardener volunteers that are working with people and maybe want to help kind of close the loop of from gardening to the more FCS side of things.
Right. And what's beautiful about those is it's one crop. So if you're growing chard, or if you're growing lettuce, or if you're growing a certain crop, that's something that you could share with someone very easily. And then they can really take that knowledge and bring it back to their kitchen, which we're real excited about, as well
Yeah.
as the gardening elements as well.
Yep. Exactly.
Yeah.
Exactly.
We've got really people really thinking about this. Oh, Suzanne said she's donated a lot of carambolas and mangoes to the food banks, and that's something that we do with our excess produce, Catherine, is to donate to food banks here in Gainesville. It's usually to the Bread of the Mighty food bank or that one. But how is that just a Band-Aid on food insecurity, the donations, or can we really move the needle with that?
I I mean, I think you really can move the needle, because so much of what is traditionally available in food banks and food pantries are those, as I mentioned before, shelf stable items that may not have, the nutrients that fresh produce does. And so having those donations plays an important role in people not just getting those shelf stable grains or sort of more convenience type items, but also the fresh produce that have, the high, all of the nutritional benefits that make it so that you're supposed to eat 5 servings each day. For many of these families, those will be their only servings of fresh produce that they get. And so it's such an important, and not everyone can be a gardener. If you have multiple jobs, they may not have the ability to garden for themselves, but they're able to, benefit from the gardening efforts of other members of the community.
Yeah, yeah. Someone put in the chat, for any community, we need a good sized area to kind of grow our foods, and some urban environments don't have the available space to satisfy the community's requirements, and that's why food is brought in. But if it can be supplemented by community gardening and getting people to be encouraged to grow their own food, Lord knows if I had to survive on what I grow in my backyard, I would not be here today. So and maybe some of you all know that the reality of that as well. So, Catherine, if would you speak a little bit about that?
Yeah, I mean, I think it's absolutely the case that we can't meet all of our needs from what we can produce within cities, but I think they can play an important role in helping to supplement getting those fresh produce items. In addition, particularly when we're thinking of the people that are low income, they the produce they grow may be making them have access to something they would not otherwise have, whether it's grown somewhere else or not. They simply don't have that produce at all. So any small amount can really benefit. Um, and one other thing to mention with thinking about this space is that you know there may be spaces in communities that could be used for gardening purposes that are not yet. And so, thinking about when you look at your food desert map, is there land there that is available that could potentially be used? And seeing, potentially if your local government municipality might be willing to make some of that land available for people to garden on, even if they don't have space in their own homes.
Yeah, yeah, it's good. Good answer. Folks who are talking about that Duval Extension is now holding a course for community garden leaders, which I think is great. That's wonderful. And there's food gleaning going on. There's gleaning organizations that exist. So, and that square foot gardening is very popular in Lee County. So there's a lot of great work that the MGVs are doing out there to support these efforts and to share that knowledge. I'm really so happy that you're able to present to us, Catherine, because I think it really underlines the importance of these outreach and these extension programming efforts that we do in the communities to work with people about learning how to grow their own food, and having opportunity to have access to at least some more healthy food out there. So we're getting close to the end. Do you have any parting ideas, Dr. Campbell?
I think Master Gardener volunteers play such an important role in educating the community and helping them have the self-efficacy and ability to grow food to help address some of these really critical issues. If we're looking at, in some cases, 1 in 4 children in some of these counties don't have access to healthy food. The That's a critical issue that can affect people lifelong. And so, you know, producing food in the community, whether you're teaching people to grow it themselves or you're a community garden that has enough that can donate, that can play such an important role in helping these families be food and nutrition secure.
Very
And every little bit helps.
Very good. So some folks are asking about those info sheets that are coming out. There a number of them are already out. So if you go to Ask IFAS and search Catherine Campbell as your author, those fact sheets will come up.
Yeah, I think a lot of them are officially in press.
In
Um,
press, yeah.
but
I would
like,
expect by next month.
yeah, easily by next month. They're just on the back end, like crossing T's, dotting I's. They're already in the system, but they're just waiting to go live. And so um I hope you all are able to use them. They're Wendy and I worked really hard on them and with the goal of them being able to be shared with folks.
Well, I'll send an email out to everybody when the whole set is available. So we'll be good with that. All right, Catherine, thank you so much. Thank you for all that you do, and we look forward to working with you more in the future. All right, take care,
Thank
everyone.
you.
Thank you. Bye-bye.
Bye.